welcome to another edition of the Corner Booth Podcast, this time from the Snowden Deli restaurant here on the Cary Boulevard. I'm Aaron Rand, along with our special guest today, Dr. Chris Labos, cardiologist with a degree in epidemiology, and Aaron Durfel, the Montreal Gazette's health reporter, and of course, Bill Brownstein of the Gazette and Leslie Chesterman. So let's get going. Dr. Labos, I guess the first thing we're going to address is the fact that you're sitting here wearing a mask,
Yes.
but none of
not.
us are. You're the
Yes.
doctor. What's the rationale here?
Well, the rationale, I don't know if you've heard, but there's this virus going around. It's made a few people sick. And I think what we've learned from this pandemic, whether you're talking about COVID, the flu, RSV, or any of the other respiratory viruses, is that airborne spread is a more significant issue than I think we initially realized. And wearing a mask, especially if you're wearing an N95 mask like the one that I'm wearing right now, it helps. You are less likely to get sick if you're wearing a mask. I mean, the reality of that, I think, should be obvious to everybody. We had no flu in this country for 2 years. We had virtually no RSV in kids. And now that nobody's wearing a mask, both of those things are making a resurgence. So even irrespective of COVID, if people wear masks in indoor settings when they're going to be breathing the same air with a bunch of other humans, as we are doing right now, it makes a difference. You are less likely to get sick, and you're less likely to spread your germs to somebody else if you happen to be sick. So I think the rationale is there. We just have to recondition our brain to change the question, not from why are you wearing a mask, but from why aren't you wearing a mask in this setting. And there's some situations where you can't wear a mask, right? If you're going to go out for dinner with somebody, you can't wear a mask and eat at the same time. That's obvious. But if you're not eating, if you're not consuming food or drinking liquids, is there a reason why you don't wear a mask? I don't think there is. I think it makes a difference, and people can still hear me. I'm not self-conscious about my appearance, so I wear it, and you know what? To the good. I don't see the downside to it at all.
Chris, I get the sense that people think it's all over. I mean, you
Yeah.
look around. I've been at events. I've been maybe one of 5 people wearing a mask at the Bell Center.
Yep.
I go to various other events. In the streets, in the supermarkets, everywhere, and you just get the sense that people have come to terms. Well, it's over. It's the flu, and that's it. And the reality is, of course, we're getting into a much more dangerous time in terms of. Not just COVID, but the flu and the RSV coming. And I think people are blissfully unaware of what might come down.
I think you're right. And I mean, this is very similar to what happened a year ago. Go back a year ago when, in fact, the cases were actually much lower than they are now. Everybody thought, well, things are fine. We have the vaccines. Maybe we'll see a bump, but it won't be that high. And then the new variant, which at the time was Omicron, emerged, and everything just got worse. And so there's a very real possibility that that could happen again. We don't know, but there are certain signs suggesting that it will. And of course, we're already seeing an uptick of cases of RSV in kids, and we're seeing the flu, and the emergency rooms are already at overcapacity. So it's not going to take much to make the situation untenable in the healthcare system. So, and it's still pretty early, right? This is early with respect to cold and flu season. Usually things get very bad as we get into December, January, and February. So we don't know what the next few months are going to look like. And, it becomes a question of, do we want to be proactive or do we want to be reactive? Do we want to wait for things to get horrible before we act, or do we want to take very basic preventative strategies? And the reality is, I mean, when you talk about masks, if something you can buy at the dollar store is going to help the healthcare system, I don't know why you wouldn't want to go and wear it, because there's really no downside.
I'll tell you why I'm not wearing a mask right now is I've had COVID.
Yeah.
And I was down for a week, not well for 2 weeks, but I've had flus that were much worse back in the day, and we didn't wear a mask back in the day. But you're right, it's also about spreading it to other people.
Well, it's also, I mean, back in the day, you didn't wear a seatbelt when you sat in the back seat of your car, right? Back in the day, you didn't wear a helmet when you went skiing or rode your bicycle. We realize we realize things. We realized sometimes that we did things that were not correct. And in fact, the problem is that we underappreciated the significance of airborne spread of viruses. Like, people used to come to the hospital with the flu. We used to put them and separate them from other patients with a curtain, which in retrospect, it makes no sense. It makes no sense. But we did it because we didn't know any better, for lack of a better term. And I think that's the reality. Now we look back and we say, oh, that wasn't that smart. We used to go around seeing patients not wearing masks. We used to let people come and visit cancer patients in the hospital with no protective equipment whatsoever. And in retrospect, the rationale of that was deeply, deeply flawed. And I think that's what we have to realize. There's just a lot of things we did that were not correct, and that we have to do a little bit better. And that if we want less people to die of the flu, which kills thousands of people every year, One of the ways we're going to do that is by having people wear masks in high-risk settings, which is an indoor space. Now, the alternative to wearing a mask is we could massively upgrade our infrastructure, improve ventilation, put in HEPA filters, and clean the air. But if we're, that's the more expensive solution, but it is the alternative. We just have to do that. We have to clean the air in the way that we clean our water.
All right, I want to talk. Aaron Durfel is the Gazette's health reporter. You're listening to this, and I know, to be honest, when you walked in, you were actually a bit concerned because you had wanted to wear a mask or thought about wearing a mask but didn't. So where do you stand on this? You've seen government's reaction to this, and you've done a great job reporting on it. Chris is talking about, HEPA filters and governments wanting to take those initiatives. They weren't done until very, very late. You could argue they're not even fully done now.
Yeah. So my take on this, I agree with you, Christopher, that we should wear masks. You'll note that in Japan, culturally, even before the pandemic, it was common for people to wear masks. Even to this day, at large sporting events, the Japanese are wearing masks, and they're not in the grip of an eighth wave the way we are in North America. So that tells you something. In terms of ventilation, yes, this is a moment for jurisdictions around the world really to get their act together. We see that in Belgium. That nation has adopted legislation to improve indoor air quality. So all these measures taken together will help us defeat not only COVID-19, but reduce the incidence of respiratory illnesses. But there's something I want to mention too. What's happening is our healthcare capacity to absorb this eighth wave. Our doctors and nurses, many of them are burnt out. Each time a wave hits the healthcare system, it diminishes it. Wait times go up. And so we've had this concussive effect of 8 waves on our healthcare system, which was really struggling in Quebec before the pandemic. And so what we're seeing now with this emergency room crisis across the country and in Quebec is not just COVID, but it's COVID hitting a battered healthcare system, and a lot of nurses who are burnt out, they've quit the healthcare system or they've gone to the private sector, and so we have fewer nurses at a time when we need them, and so this is why we've got this double whammy of not just COVID, and it could even be what we call a triple epidemic of COVID, RSV, and the flu, coinciding with a healthcare system that's more fragile than ever.
So I wanted to ask the doctor, but I can ask you the same, either one of you or both of you. You mentioned about how if you don't want to take the extreme, or if we call it an extreme measure of better ventilation and better HEPA filters, is the government at fault for not having taken this seriously soon enough?
Well, I mean, here's the thing. At the beginning of the pandemic, I think you can understand that there was, other priorities. But I mean, we're several years into this at this point. We need to start the process. It's not going to be done overnight, and there's a lot of old buildings that need to be upgraded. But here's the thing. We no longer have cholera outbreaks anymore because we systematically upgraded our water infrastructure and we clean our water so that you don't have sewer waste ending up in drinking water anymore. Well, we need to do the same thing with indoor buildings, and I mean, you're going to have to start with schools and public buildings, and eventually it's going to trickle down into private businesses. But that's the way we have to move going forward. If we want fewer people to get sick from airborne viruses, that is the long-term solution. We just have to start doing it and start doing it systematically, in the same way that 30 years ago it wasn't commonplace for new buildings to have air conditioning, right? There was a lot of buildings that didn't have central heating, but the code, if you want to think of it that way, has changed systematically so that now you can't build a new building without having central air and central heating. So we need to start thinking about our air quality in the same way. These giant, boxes that we used to build for office buildings, well, either you're going to have to pump in fresh air to prevent people from getting sick when they go to work, or have some sort of HEPA filters in place. But we need to start thinking about that in the design of buildings so that at the very least new buildings are built using a different infrastructure than what we have now.
If I can add something, which I think really speaks horribly to our record in Quebec, in 2014, so this would be 6 years before the pandemic would strike, the Quebec government commissioned a report into the air quality in school buildings, especially in primary schools, and called for improved ventilation 6 years before the pandemic. Why? For precisely the reasons that you had enumerated. And there is a growing body of research that's established that that better air quality in classrooms leads to better test scores. It's for our children, and so it's just astonishing that that we haven't really learned. You know, the warnings were there years before the pandemic.
The Corner Booth podcast is brought to you in part by Guaranteed Industries. They are a Lennox Premier dealer. They can take care of all your heating or cooling needs, residential, industrial, or commercial. GuaranteedIndustries.com or call them at 514-342-3400. They are a Lennox Premier dealer.
On a different level, I saw an absolutely frightening report on 60 Minutes. I don't know if you did. Epidemiologists and scientists were going to bat caves in Uganda and talking about
The next virus.
The next virus, and without doubt, they said there is going to be another virus. This is not over. People are deluded into thinking. Deluded into thinking that this will be the end, and it might be COVID. It's going to be something else and something else after that. How do you get that message across, and how do you prepare for viruses we don't even know about? I mean, is this doom and gloom that we're going to have to live with forever?
Well, here's the thing. Illness is not a new phenomenon. There have always been epidemics, there have always been outbreaks. The problem is that we went for a fairly long stretch without seeing one and got lulled into a false sense of security, which is strange if you think about it, because we did have SARS in this country not that long ago,
Right.
which was also a coronavirus, and yet we were able to forget the lessons we learned from SARS in a relatively short span of time. I think the way you prepare for it, you obviously can't prepare for a virus that doesn't exist yet or that hasn't been identified, but you can at the very least set up a global surveillance program. And this is where we have to pour resources into things like the World Health Organization, so that you do have better international cooperation, that when a new outbreak does emerge, they are able to go in and contain it. I mean, part of the reason why things got as bad as they did is I think there was an underappreciation of how severe COVID was going to be, because a lot of the data coming out of China originally was perhaps not entirely accurate, and we were getting a falsely mild picture of what COVID was going to look like, and I think we underappreciated how bad this was going to be as far as a global pandemic occurs. But we can take another example, like monkeypox. Monkeypox was smoldering away in parts of Africa for years, and we didn't really do anything about it until we started to see cases internationally. And so going forward, if we don't want more monkeypox outbreaks, well, we have to control monkeypox at the source, and that means getting vaccines to Central and Western Africa, you know, where frankly there hasn't up until about a couple of months ago, there had been no vaccine delivery to those areas. Now that may have changed in the interim, but you know, if we want to control monkeypox globally, we have to control it locally. And so when new outbreaks occur, whether it's Ebola, whether it's monkeypox, whether it's some new virus we haven't heard about yet, whether it's another coronavirus, if we can control it at the source, that's going to make a difference. But you need a robust international health agency that can do global surveillance and then pour resources into it. And part of the problem too is that many richer nations are very reluctant to spend money to treat diseases somewhere else. And we've seen that with HIV, we've seen that with monkeypox, we've seen that with a lot of stuff. So we have to change our framework and realize that spending money on foreign aid for health promotion isn't money wasted. It's money that's invested in the global population being better off.
I want to ask something of you as a doctor, and Aaron as well. I can't tell you how surprised, how stunned I was when we started talking about COVID, maybe a year, even a year and a half into this, pushback from people who never bought in, from the anti-vaxxers, from that whole community, where suddenly everybody who'd read anything on the internet became an epidemiologist, a doctor. I wonder if you could ever have expected that kind of pushback from people while you were trying, while the medical community was trying to come up with a cure and came up with a vaccine.
Well, so the anti-vaccine sentiment has always been there, and we saw this before COVID. It was interesting that right at the beginning of the pandemic, a lot of people joked and said, oh, COVID is going to be the end of anti-vaccine sentiment, because people are going to realize how important it is to have vaccines against the public health threat. And that was true for like a year. But the problem with vaccines is that they become victims of their own success. You know, everybody was scared of COVID, And then the vaccines emerged, and now COVID seems less dangerous to people, and people are like, well, I'm no longer scared. And so this is the problem, is that as people no longer see the imminence of a particular threat, they start thinking it's not important. And we're seeing this now with polio, where polio vaccination rates have been dropping off in the U.S. and there's local spread of polio in the United States, which is something we haven't seen in over 20 years. So this is the problem with public health. It's not one and done. It has to be a sustained messaging throughout, because people forget, in the same way that we kind of forgot about SARS when it happened, and we allowed our preparedness to fall off a little bit. So it's reminding people about things that are important even when things are good, not just about reminding them about this when things are bad.
I have a question about that. So let's say somebody I live with right now is saying, I've had 3 vaccines, I've done enough, I'm not having another one.
Yeah.
If you've had 3 vaccines and it's time for the 4th and
Yeah.
you don't take the 4th, are the 3 other vaccines no longer effective? I mean, should we really constantly be getting the upgrades? Are they fooling themselves to think that they're vaccinated if they're vaccinated a long time ago?
Well, here's the thing. It's not that, no, the vaccines are still going to work, obviously. They are still doing something. The further away you are from your last dose, the more immunity is waning. And that's the problem that we see. Getting a booster is essentially that. It's a booster. It's about optimizing your status, about boosting the protection from, to just choose arbitrary numbers, let's say from 70 to 80%. I mean, the other advantage about the bivalent vaccines is that the hope and the theory is that by giving you more broad spectrum coverage, you're going to have better protection. We'll see if that plays out in real life or not. But yeah, it's all about optimizing your protection. If your argument is, I'm prepared to get sick because I don't care, I mean, you can't argue value-based judgments with people. The problem is, when people say they're prepared to accept the situation as it is, I don't think they fully understand what the situation actually looks like. Because if you get sick, prepare yourself to wait 18, 24 hours in the emergency room to get seen. If you don't have a family doctor, you're not going to find one. You cannot, there's no such thing as a walk-in clinic anymore. I mean, think about that. There's no such thing as you have to make an appointment to go to a walk-in clinic.
Yeah.
So when people say, well, the situation is fine now, it's not fine. It's like, I don't think people understand what the current situation is and what exactly it is that they're buying into.
Or they're saying, I'm protected because I've had one vaccine 2 years ago.
Yeah.
Well,
that
1 year ago.
Yeah, that's clearly not going to be as
ridiculous.
protective.
Okay.
Let me talk about something else, because you just mentioned messaging from the perspective of the medical community. Aaron, from the purview of the government, as far as messaging goes, I mean, the first question I would ask is, what did the government get wrong? I don't know if it's a long list or a short list, but you've been on this story since the get-go. What was the first big mistake?
When we're looking at the pandemic, the first big mistake was not thinking that COVID-19 would spread through nursing homes and protecting the hospitals, and then obviously the pandemic spread through nursing homes and killed about 5,400 seniors in 2020, which was deplorable. When Christian Dubé came on the scene, he replaced Daniel McCann as the health minister. I think that he did a better job, and he was focusing on logistics of vaccination, and there was a big push to vaccinate. And Quebec was somewhat successful in this regard. It was number 1 in terms of administration of vaccine per capita among the provinces. But the government, I believe, has dropped the ball in not really pushing the message to continue with the boosters. It's done so belatedly after realizing that Quebec is now in the grip of an 8th wave. So it has to, this is where the messaging has fallen short, that it's okay to get a booster. Myself, I've had 5 COVID vaccines. Tomorrow, my family and I are getting the flu shot, and I'm not at all leery of the prospect of getting a 6th COVID shot in even a few weeks' time. And this is what I find just, unlike you, Christopher, I just felt that heading into this pandemic, I was saying, it's going to hit us. It's going to hit us. The anti-vax movement. It's going to hit us. What's happened is it took a doctor, ironically, Andrew Wakefield in the UK, to falsify, to draw a link between MMR vaccine and autism, that in a sense, in retrospect, gave birth to the anti-vax movement, which has only been amplified by social media. We don't think anything about taking an aspirin, right? When we have a headache, but there's such a visceral distrust of vaccines, even though there really been a boon, a triumph of public health. You look at a country like Cuba, which doesn't have resources, but it really pushed public health in the 1960s, and they have high vaccination rates. They don't have an eighth wave. They're not, they have had previous waves, but vaccination awareness and vaccination adherence is very high in that country. We've got to. Just as with wearing masks in public, there has to be this cultural shift. But I don't know what it'll take. It's really unfortunate.
The Corner Booth podcast is brought to you in part by Empire Gold, paying the most for your collectibles. And remember, at Empire Gold, you get paid right on the spot. And nobody pays more for your gold or silver than Empire. Online, empiregold.ca.
When we were kids, we all took the polio vaccine.
Yeah.
Dr. Jonas Salk was considered somewhat of a maverick, and yet no one had any doubts that this guy was able to come up with something. Today, a guy like that would be just laughed off of the big pharma role there, and just basically everybody would say, well, this guy knows nothing. And yet, how many lives did that save and prevent? And this is something much more proven, much more scientific. Like, in terms of the people involved, they were like very, very credible. And yet, to get this backlash, I find absolutely bewildering.
Yeah, well, I mean, there is a bit of a backlash against polio specifically now,
yeah.
but at the time, people got vaccinated because they were genuinely scared. They were seeing the firsthand results of what a polio epidemic looked like, which is children being left paralyzed, people in iron lungs, and so there was a very visceral reaction that you saw the impact that it had. The reason why polio vaccination has fallen off now is because people have forgotten what that looked like. Nobody's seen an iron lung in a generation, and so people are like, polio, what's that? I don't need to worry about it. And that's the problem, is we tend to forget how bad things could become if we didn't have vaccines and all the other therapeutics available.
We're seeing people withering away in like ICU units, like no breath, like on oxygen, like decimated, and all the rest. So I don't understand why that wouldn't like also bring out some kind of visceral reaction too. I don't want to be in that situation.
Right, because they're all taking vitamin D.
Yeah,
Right.
Yeah.
So Aaron brought up the government's messaging and perhaps the holes in that messaging. I'm curious, we would get phone calls on a regular basis from people calling out doctors.
Yeah.
And simply saying, wait a sec, I believed you at the beginning,
Yeah.
because the messaging, I guess, and I think, tell me if you agree or not, the messaging from the medical community was, take the vaccine, you won't get COVID.
Yeah.
At least that's the message people heard, not take the vaccine, you won't get as sick as you will. Why was that? Do you believe that was a problem?
Yeah, I think people want very simple answers, and I think there was a lot of the government messaging was like, get your 2 doses and then we can all get back to normal. Remember those commercials of people having parties and whatever, and that wasn't wrong per se, but it's a slightly more nuanced thing because the vaccines are not 100% effective. So you could still get sick. You're just less likely to get sick. And I will keep saying this because I think it bears repeating. You are less likely to get sick if you are vaccinated, contrary to what a lot of people say on the internet. There's going to be a lot of people on the internet saying, oh, the vaccines don't stop transmission, they don't prevent illness. Yes, they do. They've been studied multiple times, and they do show that even in kids. If you're vaccinated, the most recent data in the youngest age group showed that even against Omicron, the youngest age group, the 6 months to 2 years, were 50% less likely to get sick. So they do reduce transmission. They just don't reduce transmission to 100%. The problem is that people have only their own experience. Like, I got vaccinated and then I got COVID. Well, then the vaccines obviously must not work. And I think that's the problem. People want certainties, and there's a little bit of nihilism that exists in our society. Things are either 100% effective or they're completely useless, and people don't understand that most things exist in the gray zone. And so if everybody gets vaccinated, you have less COVID overall, you have less burden of disease, and you have less COVID circulating in the community. And we saw that. That was the result of the vaccination program. It's just that it's been imperfect, and people were unwilling to do all the ancillary things that would have made things even better.
What about long-term COVID? Because this has become a huge issue that even if you get COVID and it's mild, it almost seems to be I don't want to say worse,
Yeah.
but this is another reason that people are really suffering for years after.
Yeah.
Is this true? Is this a figment of people's imagination? No.
No, it's not a figment. I mean, long COVID definitely exists. I have a lot of people come to me. They're like, I'm not feeling well. I'm
Sounds
short of
good.
breath, and they get sent. They want a cardiology workup. I'm like, and then you question them, and you're like, yeah, I had COVID last month. I'm like, well, it's the COVID. They're like, no, that was last month. I'm like, no, it's the COVID. And so we go through all the testing, and then it turns out they have nothing wrong with them, and you're like, yeah, it's the COVID. And then most people do get better, but they get better over 6 to 12 months. Like, there are lingering symptoms that persist for a very long time. So a lot of people have, again, bought into this narrative like, oh, it's like a bad cold, I'll be fine in 3 days. No, it's like, it's not rare that you will feel unwell for 1 to 2, if not more, months after the fact. Long COVID is a big problem, and it's going to put a lot of strain on our healthcare system because most people don't have a family doctor. You can't get into a walk-in clinic, and so when you're feeling well, people don't know how to access the system, and so they end up crowding into emergency rooms. Or the reality is they're going more and more to private clinics. The number of private COVID clinics that have sprung up to address this need. And this is how private healthcare starts in this country. It's not, it's going to creep in slowly. And when we talk about the collapse of the healthcare system, it's not panic in the streets, buildings on fire, people roaming the streets. It's not the breakdown of society. It's the introduction of private medicine, where people now have to pay for things that used to be free. And that's going to be fine if you're rich, and it's going to be fine if you have private insurance. It's not going to be fine if you're neither of those two things. And that's going to be the real danger, I think, of this pandemic. It's going to introduce, in I worry, permanent way, the idea of private medicine that is going to be very, very hard to dislodge once things improve a little bit.
I want to talk about something we haven't talked about, and I'm sure people watching will have children. We've talked before about the education system and the way we have dealt with people in it as far as COVID is concerned. I still remember that famous statement by then Education Minister Jean-Francois Roberge, well, it's okay, I understand air quality is an issue, just open the window.
Yeah.
So it's
In the middle
now,
of winter,
right,
in
it's now
February.
a year or 2 years later, and there seems to be a troubling trend of not releasing data as to what is going on in schools. Is that still the case?
Yeah, this is another blind spot, another truly lamentable aspect of the pandemic. This thinking that indulging in this wishful or magical thinking that COVID is totally benign when it comes to children, and so the idea is that well, we want to get the kids back to school, but they don't need masks, and we don't need to improve ventilation. We don't want to make that investment. So we've seen that, in British Columbia, where Bonnie Henry, the chief public health officer, she was suppressing data on spikes of COVID infections in the classroom. Schools are a vector for COVID, just as they're a vector for other infectious diseases. And there has to be this reckoning that we've got to make that investment in schools. So here in Quebec, what I find just absolutely shocking is we haven't had daily updates on absences due to COVID in schools since June 14th. Parents want this information. Journalists want this information. We're filing access to information requests, and the government is covering it up. It's absolutely shocking. We want to, there's a high dropout rate in Quebec. And the new education minister, Bernard Drinville, is claiming that only 5% of classrooms in Quebec have CO2 levels higher than 1,000 parts per million. That's just not true. So yes, just to answer your question, Aaron, it is a absolutely shocking blind spot in this pandemic.
All right, we have to wrap up. So Dr. Labos, I will ask you simply, as a message to people watching, what is your message with respect to COVID now? What do you think people should be doing? Just as a final word.
Just be a little bit careful. If you're eligible for a booster shot, get it. It'll help you long term. And if you're going to be indoors in a public space with a bunch of other people, I would wear a mask. I honestly don't see the downside to it. It costs you virtually nothing. It has no risks associated with it. And it's going to make a difference. You're less likely to get sick. Less likely to get sick from both COVID, the flu, RSV, or just a common cold. And you know what? Even having a common cold, if you have to miss work for a few days, that's not fun. I don't know why you would voluntarily choose that as an option. So I would do that sort of thing. I don't see the downside.
I want to thank you both, Aaron Durfel, Dr. Chris Labos. Thank you both for being here. Thanks for watching this edition of The Corner Booth.